practitioner and clinical nutritionist here at the Psoriasis Eczema Clinic. So welcome to our first part in a short series of videos on nutrition and skin disease. And today I thought it would be a good idea to cover the topic of caffeine. Now, it's one of the most common questions we get asked in practice, which is, how much coffee can I have? Now, when I think of a food, I always think about it in the context of food as medicine. So why would I prescribe caffeine to a certain patient? Now, knowing the properties of caffeine, we know that it's quite stimulating. So it would help to increase a slow heart rate, it would help to increase a low blood pressure, it will help to increase the thought process and clarity, and it can also get you moving and get you motivated. So that's the sort of person that it would suit in a food as medicine context. So who doesn't suit? Now, the answer to this is whoever is already demonstrating all of these imbalances. So someone with high blood pressure, someone who already has a lot of thoughts going around their head, suffers from anxiety or poor sleep, someone who can overheat very easily, which is typically describing someone who's in a chronic stress state. So someone who's often in the state of fight or flight. Now, to be honest, a lot of the time when patients come in, that's exactly the state that they're in. So adding coffee to that scenario is just encouraging that imbalance of overreactivity, overheating, overstimulating thoughts, etc., etc. So when there's a skin disease, typically a patient will have stress as a trigger. So ideally, we don't want to encourage those imbalances, and we often do recommend cutting back on caffeine. But that doesn't mean giving it up altogether. So the number one way to keep caffeine and coffees in your life without having to give up, but also still improving your skin, is to follow these simple rules. Now, number one is enjoy your coffee, but opt for no more than one per day. And number two is to make sure that that's not after 12 p.m. Rule number three is to make sure it's not the extra large coffee on the menu. And rule number four, it's have it every other day so that your body doesn't get used to it and it turn into an addiction and a habit. So when you do it in those ways, you can still get great results for your skin, but not to the point where it's exacerbating your skin issue. So I hope you enjoyed today's session and look forward to the next one. If there's anything you'd like me to cover in particular about nutrition and food and your skin disease, please send us a message below and let us know. Thank you. Bye.